afternoon.
Good afternoon. My name is Katharine Ligan. I'm the Mental Health Policy Analyst with the Center for Public Policy Priorities. I appreciate the opportunity to testify before you today, specifically to address the benefits of expanding Medicaid as it relates to mental health and substance abuse. And I'm testifying for the bill. Thank you. Access to public or private health insurance is a big factor in whether an individual with behavioral health needs receives treatment. Persons with mental illness show up in high proportions among Americans with low income and no insurance. In fact, individuals with mental illness are twice as likely to be uninsured as individuals without a mental illness. Individuals with untreated or undertreated serious mental illness are often among the highest consumers of multiple specialized state and county services such as child welfare, public health systems, special education, and the criminal justice system. This kind of cross-utilization of services due to the lack of consistent treatment is both costly to taxpayers and often results in a lack of continuity and lower quality of care. Limited community mental health coverage and services creates a double-edged sword by creating a de facto system in which services are provided through the emergency rooms, jails, and hospitals. Individuals in a mental health crisis consume a large amount of resources in a short time frame, which is much more expensive to the state and counties. As important as crisis service capacity is in our system, greater investment in community services is needed to reduce avoidable crisis and save money. Most importantly, the expansion of Medicaid provides the opportunity for individuals with serious mental illness to obtain health care coverage and therefore continuous and ongoing outpatient mental health treatment. That's all I have for you today, but I'm willing to answer any questions that you might have.
Thank you for being with us. Yes.
Thank you very much, Madam Chair. Now, the people that I've talked to that run the local authorities and the centers have said that if we did the Medicaid expansion, that somewhere either higher, some point higher than 80%, that the folks that they serve now would probably cover 80% of those folks.
That's my understanding as well. Thank you.
And so,
the point I'm making is this: if we look at people who you see on the street that don't have services because the state is the only, if they're not, we had some of this discussion this morning. If somebody is not deemed disabled, they do not get health coverage for mental illness. And so Texas has one of the lowest rate of qualifying somebody for disability services of any state. So that means that group of people doesn't get to Medicaid to provide health care because of their disability. I think there's a misconception that Medicaid actually funds coverage or help for mental illness. It does not. And the only way that people who have mental illnesses will be across the board covered that's not state funds, it doesn't come from our appropriation, would be from expanding the Medicaid population or the eligibility. And again, I've talked to people that it's 80 to 90% of those individuals would then have a card. The ability to choose their provider and get better care. So that's the point. I mean, I'm sorry, I thought it was...
I needed the dots connected.
Yeah, and that's the point. But that also applies to cancer. It applies to many chronic illnesses, because if you have people who cannot work because of their illness, their income is low, and then they don't, so they end up paying out of pocket if they don't have access to some form of treatment for that chronic illness. So
thank you.
Thanks.
Thank you for being with us.
Thank you. All have a great day.